Good afternoon, everyone. My name is Carol Burnett. I'm the Executive Director of the Mississippi Low-Income Child Care Initiative. We want to welcome all of you to our webinar this afternoon with the Mississippi Department of Health. We're very fortunate to have with us today Festus Simpkins, who is the Health Department's Director of Licensure and Regulation. Many of you know Festus. He's been in his position a while. We have Tabitha Bynum, who's the Bureau Director, who is going to be joining us as well. Today's webinar focuses on childcare licensure and any of the regulations that might have been changed as a result of this coronavirus emergency, and any public health guidance that the Department of Health has to share with childcare centers, especially those who have continued to remain open. Let me just remind you that if you would like to ask a question, at the bottom of your screen, if you're on a computer, you will see a Q&A button, and you can go into the Q&A and type your question, and I will take those questions and ask them of the health department officials who've joined us today. If you're on a smartphone, if you touch your screen, the menu will pop up and you'll be able to get to Q&A that way. And so we look forward to your questions, and to start off, we're going to hear from the Department of Health so that they can give us their update. So Tabitha and Festus, I'm going to let you take it away. Thank you.
Great. Good afternoon, everybody. We're happy to be here with you guys. Couple of things that we just want to share at this time. Of course, we've not mandated any closures of child care facilities. We're not conducting any inspections. We have also postponed our trainings through April. We're going to keep in close contact with our centers to give updates on closures and answering questions as they come in. We're taking self-reports and providing technical assistance by phone and by email. We're also keeping track of the closures of facilities. So if you have closed and have not reported that, please do so to your license official. If you've closed and reopened, if you also let them know, because we are keeping an updated list of those so we can update your status. We also want you to all know that we're here to answer any questions, provide any technical assistance that we can. So like I said, your license officials available, please email them, let them know if there's anything that you need. We want to encourage you to reach out to them because that's what they're there for. Please continue to follow the guidelines from CDC, the ones that MSDH puts out, as well as your local officials. We're working hard to ensure that the children of Mississippi are safe and healthy. As we move forward, we want to continue to assess this situation and make changes as needed. And we appreciate your patience and your hard work during this time. We know it's difficult, and we're just all here to try to work together. And like I said, keep the children safe and healthy in Mississippi. And that's all I have for now.
All right, thank you, Tabitha. Festus, do you have anything to add? No, ma'am. That's pretty much covers it. We're just doing the best we can under the circumstances, and we really emphasize with the child care providers. They're doing a tremendous job and under a very, very difficult situation, and we applaud their efforts to provide the child care that's needed for people that still have to go to work, and our first responders, and all those that are attending their facility. All right, well, thank you so much. I had a couple of questions that we'll start with. One is that the child care centers have been given the guidance that if they're open, there should be no groups larger than 10, and that number includes staff and children. But the question is that a number for a classroom or for the entire child care center?
The recommendation is by classroom right now, not for the entire center.
All right. We have a question. Oh, sorry, go ahead,
Yeah,
Festus.
one thing has happened, because I know this has happened in certain areas. Some local governments have put in restrictions that the facility cannot have more than 10 children. So you have to follow the local government directives. Our recommendations are it's per class, including the teacher and the teacher assistants if there is one. But local governments may have different requirements, and they are being enforced by the local governments.
There are a number of questions about child care centers and whether they are considered among the essential services.
Yes, childcare facilities, I think, have been deemed as an essential service as of now, yes.
Now, again, the thing is, that's the position that they've put out, but even in the governor's notification the other day about what should be done about social distancing and what facilities should close and things like that. Those are the guidelines from the state at that level, but the local governments can do something different. And my understanding is Vicksburg, they've mandated all child care facilities closed. So that overrides whatever the government says that they can stay open if they want to, but the local government has said, no, they're going to close.
I had a question about what centers should do if they need technical assistance for an addition of their child care center building.
They want to add a classroom, I'm assuming, to the capacity that they have now. Then we are not going out for any type of inspections during this time. So to do that, we would need to go out to the facility, and so that would not be possible at this time.
There is a question about whether child care staff can get protective personal equipment.
Not that I'm aware of. Festus, you may have an answer to that.
I don't know anything about that. That would be, you know, the responsibility of the provider or the individual if they want to buy a mask or other protective gear. And that would be up to their decision to do that if they wanted to. But as far as I know, there's no issuing of protective gear by the state in Mississippi.
We had a question about where closures have been mandated either by a county or a city official, and whether that includes child care centers.
To me, they have to ask the local officials regarding that announcement, whether they're included, if they are included in that closure mandate.
We had a question, does child care licensure have a pandemic plan for child care facilities? And if not, do you plan to develop one like other states have done?
A plan, I'm sorry, I didn't catch the question. Can you repeat it?
Yeah, a pandemic plan for child care facilities.
I'm not really sure what you mean by a pandemic plan, other than if we have put in any sort of, I mean, we've just given guidance on, of course, the classroom sizes, different recommendations on disinfecting and cleaning and that sort of thing. Nothing has been put as far as an ordinance of any type or an actual change to any regulation at this time, but we have just given out guidance and recommendations.
There is a question about whether, if the governor has a shelter-in-place order, whether child care centers should stay open.
Again, I think that is a local, if they have not given a local ordinance or mandated closure locally, then we are leaving that at the discretion of the child care facility.
Well, that question was in the event the governor orders a shelter in place for the state.
I can't answer just because that's kind of to the future, and I don't know what that would entail and what that would look like. I think that's something that Dr. Dobbs, it would be a decision on his part, so I really can't answer to that. Sorry.
I'm guessing that if childcare were identified as an essential service, then that essential service would be allowed to remain open, but I suppose we would have to wait and see what the order said.
Correct.
Yeah. One child care center is waiting on a hearing and wants to know if the hearing can be done online.
First, Carol, if you don't mind, Melissa is on as well. Is there any way you could unmute her?
Yes.
Thank you. We are suspending, I think, all of the hearings at this time. So if they had one scheduled, if they'll contact, let them know that that will be rescheduled. Once we get through all this, we'll get with them and get that rescheduled. So we're not doing them online, but we are going to suspend those for now and reschedule at a later date.
We've had a couple of questions about child care centers wanting to know what to do about not being able to buy all the milk they need.
Okay. So we've had several of those come in to us as well. We, of course, prefer milk if that's possible, but we do understand that there's been a shortage of that. So in that case, if they cannot get that, we would ask that they use juice and, of course, have water available at every meal.
I've had a couple of questions about what happens if a parent tests positive. Should they report that to the Department of Health?
So far, we've, the ones that we have had to test positive, I believe, have all reported through the child care facility. The parents reported them, and they are reporting to us as a self-report, and we're entering those and handling those as they come in.
And I've had a number of questions about what child care centers should do if they get a confirmed case in their center.
Go ahead, Melissa.
If you want me to. If you get a confirmed case in your center, we're going to be working with our EPI department really closely. EPI will be working with those families. They are actually making phone calls to every positive case in the state. We are rostering nurses right now to make sure that all the trace backs are done so they can look at where those individuals might have been, who could have possibly been exposed. So we'll be, our EPI department is working with them to make sure that that's taken care of. If you do get a positive case in your facility, then contact us. We'll work you through the steps on what you need to do and just walk you through that process. And I wanted to mention too about the PPE. I know that's been a big concern for everybody. It's been a big concern for us and for healthcare workers just in general. PPE is hard to come by, as everybody probably knows. There is a tiered structure for you to receive PPE. Obviously, they look at healthcare facilities and things like that as far as distribution of those PPE, and those go through your local EMAs. So if you have a drastic need for PPE, you're going to submit that locally to your emergency management folks, and they will assist you with that. But I will tell you, it's hard to come by. We are having difficulties right now with nurses that are employed in licensure actually getting PPE. So that's definitely been a challenge for us. Also, just to follow up on the pandemic plan, we want all the child care facilities to utilize their emergency operations plan. Possibly in the future, we would expand that to include some type of a pandemic. We could work then with the Office of Emergency Planning and Response to put those necessary components in the plan so that that can be included. This is, as y'all know, this is new territory for everybody. This event is changing every day. Things that we thought that we were going to be doing yesterday are being done differently today. Some of the epidemiological things that are being planned out yesterday have changed between yesterday and today. So we just ask that you bear with us. As soon as we get guidance, Dr. Dobbs is looking at guidance for child care facilities that do decide to remain open. We are aware that local governments have closed them. That's definitely within their purview to do that. But we are working every day. I will just tell you that that Tabitha's got a great team working with her. And if you can just reach out to your licensing official with any questions that you have, I promise you that you'll get an answer back. Thank you.
Thank you so much. I've had a couple of questions about what centers should do if they're unable to obtain cleaning supplies. They're wondering if there's anything they could get, a letter that would show they're an essential business, that they may be able to show a retailer so that they could receive more than the rationed number of supplies, where retailers are only allowing consumers to get a limited number of products.
You probably need to push that request to your local emergency manager. They would be able to do that a little more efficiently, possibly, than having to go to different retailers, getting any kind of thing, because you don't know whether or not they're going to cooperate or not. But if you push it through your local emergency managers, they should be able to do that. That's where we're actually getting some of our cleaning supplies is through our local emergency folks, and they're pushing it out through the warehouse. So.
All right. We had a question about a center that is up for renewal. Will an inspector come out? Will the license still be renewed? And how would that work?
So right now, they're not coming out for inspections. If they are due for a renewal, then the license official, if the license official has not contacted them, then they can always contact their license official for questions. But we're looking at extensions on those. If they can't get certain documents, depending on the situation, we're looking at them case by case to see what they need to get that renewal. In a lot of cases, they're not able to get a fire form due to the station's inspectors not going out. So that's where we would issue an extension. So just, again, a case-by-case basis. If they have any questions, please contact their license official. And we're working through those.
I had a question about a center that has only 2 employees working 4 hours a day, and they're trying to stay with, let me just read this question. I currently have about 5 to 9 kids a day between 8 weeks and 12 years, but I only have 2 employees, my food service person who works only 4 hours a day, and 1 caregiver working 10 hours a day. She wants to know if she would be out of compliance because she can't afford to pay but just 1 person.
And that was a long question. I don't remember in the beginning if she mentioned how many children she had versus the number of staff. I think you said 2, but we want to in that child ratio if possible. I would say person needs to have that letter of suitability. So if she needs some extra help with maybe meal time or different times of that nature, then maybe she could get a volunteer to come in to help. We recommend that anyway, often for people to come in and help with mealtime or that sort of thing. Just without that letter, we want to keep in mind we don't want them to be alone with the children, but they could help with those other activities.
Yeah, I think that question really spoke to the issue of the challenge that childcare centers are facing right now, having enough employees and complying with the keeping groups smaller than 10 in each classroom. For older children, where normally they would be allowed to have a larger number in the classroom, childcare centers are having a difficult time affording the additional staff that it would require. So I think the question was more whether those ratios remain in order now.
Yes, for now, we have not made any changes as far as the ratio. I think as Melissa spoke earlier, we're looking at some different guidelines that would be put in place hopefully in the future, and looking at some changes can be made to better help these childcare facilities to make understanding. So we are looking at a lot of those issues that are coming as far as staff not being at the facility, missing staff, or because of the small group sizes.
I've had a couple of questions about renewal fees. Are childcare facility renewal fees being waived for license renewal?
No, they have not been waived. They can go online still, just as always, and do their renewal application and pay their renewal fee. And as I said before, the documents that may not be able to be attained during this time, we are doing some extensions for the license, but we have not we've not gotten rid of the renewal fee in that process.
And another question with regard to can childcare centers get their license and renew their license online?
They can. It's we've actually had the online system in place for a couple of years now, I think. So yes, they do that. Whole process is online. The only thing different now is that we are not going out and doing inspections. So however, we do 60 to 90 days ahead. So those that are expiring for March and even for April coming up, more than likely have already had that inspection. They may have needed a follow-up or something of that nature, depending on their inspection. But yeah, we're keeping the process the same, and they should have already had an inspection, hopefully, during this time.
So I have another question about the group of 10 and under. And the question is again about the classrooms where a larger number than 10 are typically enrolled. What is your advice to a child care center about how to deal with that size classroom? If they have a classroom that has a larger number than 10 in it, what are they supposed to do?
Well, at this time, we just have given, and Melissa, you can correct me if I'm wrong, recommendations based on what the CDC has provided, Dr. Dobbs has provided. We are going off of those recommendations and asking that they try to keep those at 10. There's been no change as far as, like I said earlier, concerning ratio or regulations and those sizes, an actual change to the regulations at this time. It's a recommendation. We ask that you follow based on what we have been given guidelines on from the CDC.
I've had a couple of questions about child care services for essential workers. Are child care centers given any guidance as to whether they should give essential workers' children a higher priority than other parents who are trying to get children enrolled in their center?
I think that's a decision that they would make, based on the situation, kind of like we do as far as different situations that come up with us, a case-by-case decision that may need to be made. I do know that those healthcare workers, first responders are in need of child care. So I think it's very important that, yes, we get those in if possible, because they are very much needed in the communities right now.
I've had a couple of questions about training, and will it be made available remotely through some virtual option since providers are not able to attend training in person?
We do not have online training or virtual training in place right now. We have canceled the trainings through April, as I said earlier. There are online trainings that are available that are approved trainers already that are on our list of trainers that they can go to. But as far as MSDH providing any type of virtual or online training, we are not at this time.
I will add though, we've, just like you, Carol, we're taking full advantage of Zoom. So,
Yes.
and I'd much rather do that than be in a room with a whole bunch of people right now.
Yeah.
We are looking at accounts for each of the different program areas so that we could possibly do that. Not only will it help as we kind of transition out of this pandemic, but, you know, it would also help too, you know, possibly get more people to attend if they could pop on a Zoom training really quick and then, you know, get that taken care of without having to travel. Sometimes people can't travel because they're busy in their centers, and we understand that. So this is definitely a game changer for the health department and the way that we do business. So we're looking at all that right now, but like I said, we are definitely taking full advantage of Zoom and its capabilities. So,
Thank you. I had another question on this point and have had several on this point come through. So could you just once again walk centers through the steps that you would recommend that they take if an individual tests positive in their center?
do you want me to take that tab, or are you going to take it, or?
You go ahead. You had that one.
Okay.
So I'll let you go back to that.
Okay. So if you have an individual that tests positive in your center, it's a little different optic. If it's a child, obviously that child would be pulled from the center. And then basic guidance that we're giving everybody is that you're just looking for signs and symptoms among, you know, either your staff or other children in the facility. We do know right now the evidence that we've been given, or the science that we know about right now, shows us that children don't have as bad outcomes when exposed to COVID as maybe older individuals, you know, like Festus would have. So, and I'm just kidding. He probably didn't hear that.
I've heard it.
You know, I'm kidding. You know, I'm kidding. If you have staff members that are positive, obviously, we're concerned about that. You would do the same thing. They would not be coming to work. They would be in isolation, you know, through their illness. I will tell you that our epi department is stepping up their activities when it comes to people that are confirmed positive, making sure that they do isolate, making sure that that people that have been quarantined stay in quarantine. As you know, quarantining is for well people to make sure that they don't get sick, and isolation is for sick people to make sure they don't infect others. So really the basic recommendation and what child care centers need to take away is that if it's a child, if it's a staff member, then they just need to remove that child or staff member from the center and then watch for signs and symptoms. They'll probably be contacted by epi, follow their recommendations. Certainly don't panic. We're here to help in any way we can. There is a COVID-19 response line. You can contact that hotline. If you have any clinical questions that are related to COVID, that will send you through another hotline option to go and speak with an actual nurse, and they can give you quite a bit of information. We've had quite a few calls from not only healthcare facilities, but a few childcare facilities as well. So we stand ready to answer those questions if they have them.
All right. I had a question about if a center chooses to close, is there a time frame to be closed, or is there any penalty for a center having been closed?
There's not a penalty that I'm aware of, Tab, for closing a childcare center. That's definitely a business decision that you would make as a business owner as to whether or not you would do that. Tab, you can chime in if there's anything different, if I've missed anything.
All right, I had another question. My center is closed now, but I plan to open on Monday. But what will happen if I'm not able to get the digital non-body thermometer? Can I still open, or is the thermometer not necessary?
I wouldn't, unless you can get a thermometer and be able to monitor children for signs and symptoms, or, childcare facilities are some of the best I know that monitor for temperature. And I think that's the reason that, we've looked at their practices versus, other practices. We know that they're used to doing this. They're used to looking at children and making sure that they're not running a temperature, that they're not sick, that they're not infecting other kids when they're there just on a normal day. So I would definitely make sure that you have access to a thermometer that you can take children's temperatures with.
And I have another question. What if you've been trying to reach out to your local licensing official and they haven't responded?
You can't. I don't think Tabitha's muted apparently right now. Based on the sign language I'm seeing.
Okay, hit unmute. Okay, she's
I got it. Okay. I'm sorry. I was going to answer before, but I couldn't say. Will you repeat the question? I was in the process of trying to unmute myself.
What's the question? Oh, the question was if you are trying to communicate with your local licensing official, but your local licensing official is not responding, what do you do?
Well, you can call the central office and they can get in contact with that license official and have them to respond, or with my one of the supervisors for that area, or myself. Any of us would be glad to contact them to help them. The license officials are doing telework right now, so some of them may be having some problem as far as if they're trying to get in touch with them by phone. Then they may not be able to do that right now, but they all are checking emails daily and getting back with them. And, if they can't do that by phone, then they are doing that by email. But again, they can contact the central office and get in contact with any of the supervisors if they need to.
Okay. I had a question about if a center owes a fine. Are those being collected now, or are those being waived now?
And Festus may want to chime in. As of now, we have not issued any of the monetary penalties recently. If they were issued when they have not been sent out during this time. We're holding on to those until we can get through this and get to a point where we feel like it's time to get those sent out. So we have put those on hold. Any that were done previously, depending on, again, a case-by-case basis, if they were issued 6 months or a year ago or several months ago, they are normally to be paid within 30 days. So just depending on that time frame, I think is what we're looking at and trying to help the best that we can to get those taken care of as quick as possible. But if need be, we would be able to put those on hold possibly, depending on the situation.
Yeah.
Go ahead, Festus, sorry.
The last monetary penalties I sent out were before the COVID-19 really took effect in Mississippi. So those are older monetary penalties because there's a lag time between when they're assessed, when I get them, and when I send them out. So I would think the vast majority are old penalties that should have been paid previously within the 30-day period.
Okay, I had a follow-up question to the thermometer question. And this center says, I have regular thermometers, but the state required digital non-body touch thermometers. And those were the ones that she was unable to find.
I would say, Melissa, you can, may want to add to it. If they could get those, that would be great. I think that's what would be preferred. But we do want to take a temperature, whether they are able or not. I'd say get what they can. We prefer those, but if not, let's, still be checking temperatures with what they have and it's available.
Yeah, I think the main thing is if you don't have a non-touch thermometer, you have to disinfect the thermometer each time you use it for each child. And that takes a little time and a little effort, but it can be done.
Well, and you can also get the thermometer covers as well, those sleeves that you can put on it. So those are pretty effective. And those can be, those can be gotten, I think. So if you can't, like I said, go through that local emergency manager and request those. And if they have any trouble with that, let the licensing official know, and we can try to help with that effort.
Okay, thank you. I know that we've talked about what to do if a case is positive in the center, but I've had a number of questions that are specific to the circumstances about what if a parent of a child that's enrolled has a positive test result. So what should the Childcare Center do in that case?
So if the guidance right now and what EPI is telling other individuals too is if it's a household case, which means you're in the house with that individual all the time, then that child would need to be pulled out of the facility and not allowed, to come back until that parent is well. And then also you would need to continue to do your monitoring for signs and symptoms. And I think that's something that y'all are doing anyway. You're looking for that kind of response. You're looking for a really dry cough, a fever over 100.4. And, sometimes, some people run a little bit higher baseline temp, maybe 99 might be their regular temp day in and day out. Mine tends to run on the low side. So you do have a little bit of leeway in between temperatures. You just, need to talk to the individual about what their temperature normally runs and the parent as well. But just continue to do what y'all do most days. If you have a child that's sick, then that parent comes and gets that child. If it's a child that has those signs and symptoms, then you might want to suggest that they contact their pediatrician to get that child tested. But that's going to be a decision that's going to be made by the physician.
There has been some discussion about emergency child care centers. Do you have any information about whether such a designation is being discussed, and if so, what an emergency child care center designation would involve?
Right, we're looking at that right now, and we'll have some guidance that'll come out regarding those relatively soon. As soon as it comes out, we'll make sure that we share that with the community.
And would those be emergency child care centers that are existing centers that would then attain that designation somehow, or what are your thoughts about what that's likely to mean?
Right. What we're looking at now is making sure that we have enough child care facilities for healthcare workers, first responders, police officers, those type of individuals. That's the model that we're looking at right now. And there will be certain criteria that have to be met in order to become an emergency child care center.
I had a question about staff not meeting the training hours, the 15 hours of continuing education. If staff are being laid off, or if staff don't have those trainings to attend, is that requirement being waived at this point in time?
I think we'll be looking at that. I'm sorry, Tab. I think
No, go
we'll be
ahead.
looking at that. You know, like I said, this is a game changer for us too. Certainly we're not gonna, you know, penalize the center because, you know, we've had a pandemic outbreak in the state, so, or in the country, or the world. So we're gonna look at all that and make some concessions for that type of situation. We're doing that across some of our other programs too. I mean, as you know, the president has done some, you know, pretty aggressive waivers across the healthcare industry. So we're looking at all that, and we'll be working with centers through this. This is not a reason or a time to penalize centers.
Do you know how many centers are open right now in Mississippi?
I know we have, I think last we looked at, and that changes day to day. So we have probably, I would say over half of our facilities are open as of now. Maybe a little less.
I had a question about what is EPI? You mentioned EPI a couple of times.
I'm so sorry. I talk in emergency response language a lot of times. I apologize for that. It's epidemiology. So those are the individuals that actually do the tracing of disease. They look at the history of the disease, and then they go forward. These are medical doctors, nurses, those type of folks. So it's epidemiology. I apologize for that.
And I had a question from a center wanting to know, if one center has been closed down because of a positive test, would you recommend the children that were enrolled in that center that still need care moving to surrounding centers in that same area?
So they were shut down because of a positive test? Or did they shut themselves down?
They shut. I think that the questioner meant they shut themselves down.
Okay. I would think that if the children remaining, yeah, I think I would be more comfortable talking to epidemiology about that and what that recommendation would be. As far as those children, it would just depend on the contact that, if there was a positive child in the facility. Is that what you stated, Carol?
Let me get clarification on that.
Okay, that's right. Sure, you can email me and I can certainly get y'all, a better answer.
Okay. Let me see if I can get that. Let's see. There is a recommendation that current operating centers be considered for the emergency center status if that emergency center status is a designation that's going to be given to child care centers.
Okay.
Let me see. I'm scrolling through the questions now. There were a lot of concerns about the small group size and the centers having a hard time affording the number of staff it would require. Let's see. I think I'm being told, hold on just a second. Can you, what is considered emergency status?
As far as a center designation,
Yes.
those would be for emergency workers.
And that means for essential workers or what?
Correct. Correct.
All right. All right. Should child care providers only provide services to essential workers or to all parents? This center says she has some parents that are still working versus ones that aren't working due to businesses being closed.
I think we spoke a little bit on that earlier. Of course, we want our healthcare workers, our emergency response workers, those essential workers to have childcare. Obviously, it's very much needed. So I would say that would be a decision for the childcare facility on a case-by-case basis on whether they can accept other children and how they want to do that as far as prioritizing the parents and the children, determining, you know, whether they're essential or non-essential. That's kind of a decision that they would need to make, I believe. Oh, we can't hear you, Carol.
Okay. So you're saying that if the children are already enrolled, it's up to the center as to whether they should remain serving children of parents who are working or children who are in considered essential workers. It would be up to the center to make that
Yes.
decision.
Yeah.
Okay.
I think also one of the main things is that the 10 per classroom, regardless of the license capacity, be adhered to, and that includes the staff, and that you know that those guidelines are given out. You could have a facility that has X number of classrooms, and their maximum capacity for the facility is well above 10 children and staff per classroom. So I think sometimes it reduces the number of children you're going to serve. And again, Tabitha's stated that, you know, it's a business decision whether you're going to make room for emergency responders or first responders and take other children out of your facility to accommodate them. And that's still a business decision to be made by the provider.
All right. There's a question about whether open centers should require that their staff wear masks.
So masks are typically for sick people. So you know, if you have them and want to wear them, that's totally up to you. We're not requiring that you wear them. Obviously, we want to make sure that those supplies remain in the supply chain and are available to healthcare workers who right now are struggling to get PPE. There's different levels of PPE based on you know, your exposure levels in a hospital setting. So you know, certainly if you feel better wearing one, then that's fine. But I think it would you know, unless you have an active case or been around somebody, if you're going to wear a mask, it should be that you're probably not working if you've been exposed to somebody with COVID. So I don't think there's any need to wear a mask. You know, we're here at the health department basically conducting emergency operations business, and you know, we try to limit you know, our groups to less than 10 or less, and we try to remain pretty far away from each other, but we don't have people up here wearing masks. And I think the same should be for a child care facility as well. Should make sure that you monitor those children for signs and symptoms when they come in, and make sure that, you know, if you have a child that's been exposed to COVID, that child is, you know, removed from the center, and that you work with epidemiology as well to make those decisions. But there's no need for you to wear a mask.
I've had a couple of questions, and actually earlier there were also several questions about what would happen if the governor issues a stay-in-place order. What should child care centers do in that instance?
I think it depends on what that order says, how it relates to child care facilities. I think we'll see that if one is issued, and if not, there will be guidance that's out there by the health department to direct child care facilities as to what they should do in response to that.
All right. I think you've spoken to this, but there is a question. What if you have 3 classrooms and you're only licensed for 15 children? Can you have 19 children in each classroom during this time?
No. We don't want to go over the capacity of the facility at any time.
There have been some questions about the reimbursement rate in the child care payment program, and we did have a webinar yesterday with the Department of Human Services. There is a question about whether the full co-payment fee has to be charged if the center was only open for 2 weeks in the month of March. Do you know the answer to that question? Or do we need to refer that to DHS?
Probably refer that to DHS.
Mm-hmm.
We had a question about whether parents should be allowed to continue bringing their children to the center if they're not working, because a parent said she would call the state licensure office saying that the center was discriminating against her kids and the state was paying for the attendance. The question is, would you support the child care center in the decision they made in that case?
That's
Again, I think that's a business decision by the facility. We don't say which children they can serve or not serve, other than if they have a sick child, they don't serve that sick child, or they don't have the means to serve a special needs child. We would not let them serve a special needs child. But those decisions are made by that provider.
So there is another question, just to clarify. Are you saying that as the child care provider individually has to determine whether or not to serve a child based on whether there is a person in the family who's been exposed or tested positive? It's the center's decision, is what you're saying?
If there's a person in the family that's tested positive and that child lives in the house with that family member, that child should not be coming to the center.
Okay. Did you all on the from the health department, do you have any closing remarks that you would like to make in the last few minutes of our webinar?
I'll just close with telling y'all how much we appreciate those of you that continue to be open, what you're doing for your communities, what you're doing for healthcare workers and just people that are still having to go out and do the work. We appreciate y'all working with us during this time. Like I said, it's a very, very different time for us as an agency. This is not anything we've ever dealt with before. I've been with the health department for a long time, Festus even longer. And I don't think that that any of us have dealt with this kind of kind of issue before. We're here to help you work through this process. If you need us anytime, just like Tabitha said, contact your licensing official. If they don't know the answer to the question, they can certainly let us know. And if we don't know the answer, we can certainly get the answer for them. So we just appreciate your patience during this time and appreciate what you're doing for the children in the state and for the community. And we appreciate you too, Carol, having this webinar. So thank you.
Thank you. And let me just circle back to one other thing. There is just a lot of confusion about this issue of 10 or fewer. Can you just clarify how centers are supposed to implement that? If they're licensed for a classroom that normally has more than that, are you saying they're limited to 10 or less, counting the adults? I mean, can you just be very clear about exactly what that is? That a new requirement that the centers are being held to, and exactly what that means for a center that has normally got a larger number than that in classrooms in their facility?
Oh, I think, and Melissa, you can chime in if or Festus. It is a recommendation right now. CDC has recommended that. We have recommended that based on information that has been provided to CDC. So I think right now, to answer that question, it is a recommendation. We would really like for these facilities to keep those group sizes to 10 or fewer. We understand it's hard. We know it's a struggle right now for everybody, and we just really want to thank them again for their patience and for doing the best that they can to continue serving children. It has not been made, there's been no regulation at this time. It is strictly a regulation that we are hoping they can follow.
One thing is that it goes along with the recommendation from the governor about group sizes in the general public, about 10 or fewer. That's just an extension for that. We have to remember these children are in close contact with each other for long periods of time. So if you do have a child that's going to be sick, it's probably going to spread. And heaven forbid it happens. We really hope it doesn't. And also, I know one city that has limited the operation of child care facilities to 10 children in the facility total, regardless of the licensed capacity. So local governments can also pass some ordinances or rules about the operation of a child care facility.
That's right.
Yeah, I think everyone agrees that that is the best practice and that is the recommendation, and knows that from CDC guidelines. I think the struggle, as you know, that child care centers are having is that means that in some instances they have to have more staff, which they don't have the revenue to pay for. And that's their dilemma, trying to deal with that right now. But as I understand what you said, that is a guideline, a recommendation, but not a new requirement.
Correct.
That's correct. Not at this time.
Okay. All right. And we would hope to hear from the health department if there is any guidance from the state level or even locally with regard to stay at home order. If childcare centers are considered essential services and are exempt from that, it would be really helpful to have guidelines from the health department for childcare centers about how to continue to function under those new circumstances. So we would encourage, is there a location on the Department of Health's website? Is there a place where childcare centers can go to find updated information that might come out that gives them guidance specifically with regard to emergency childcare or to new recommendations that are coming from childcare licensure in these times when there is a lot of uncertainty among childcare centers about how to move forward?
Yeah, that's coming. Obviously we want them to follow the CDC guidelines as closely as possible. But we are working, I've been working with Tabitha and Festus this week to try to develop maybe a list of frequently asked questions so that childcare facilities can go to that. Thank you. So that childcare facilities can go to those frequently asked questions, maybe get their question asked or answered. And then as this progresses, if anything does change, if we do make an emergency change to regulation, which we do have the authority to do at this time, but if there is any change, that will be posted on our website and it will be obvious where it is. If you go to our website, you'll see COVID all over there, and there's you hit those links and it'll take you to the different sections that would apply to your childcare facility. So we'll make sure that you definitely know.
All right, that sounds great.
And our website,
Go ahead.
I was gonna say our website is www.healthyms.com, just to make sure everybody was aware of where they could find that information.
All right, great. Well, thank you so much. We really appreciate you taking the time to be with us on this webinar today. And let me just remind everyone who's on the webinar that a recording of this will be available. We're going to email it to everyone who signed up to be on the webinar today. So you'll be able to refer back to any of the questions and answers that you might need to review again. Thanks
Absolutely.
to everyone for joining us.
Thank you.
Thank you.
Thank you.
Goodbye.
Bye.
Bye-bye.